Welcome to chapter 16. This is our last chapter of the textbook. It's our last video lecture. I'll only have one video lecture for this chapter. I have uploaded other videos that I'd like you to watch that show different types of therapies, different psychotherapies, and we'll talk about that in this video lecture. So let's get started. All right, so in chapter 16, we are talking about therapies. How do we treat the different psychological disorders that we discussed in our final projects? This quote will begin with this quote from Carl Jung. He was he was known as a neo-Freudian. He is a psychologist, was a psychologist. And he said, the principal aim of psychotherapy is not to transport one to an impossible state of happiness, but to help the individual acquire steadfastness and patience in the face of suffering. So think about what he's saying here. So psychotherapy is the term for therapy. You might call it counseling. So what's the goal? If I'm going to go see a therapist, we want to be realistic about what it is that's going to happen when I go to therapy. Am I going to come away with all of the answers to all of my problems? Is the therapist going to magically somehow make me as completely happy as I could ever imagine? Of course not. So therapy isn't about making all of the world's problems go away and somehow I'm magically transformed. No, therapy is a way of helping the individual access their own resources, tap into maybe other resources that are available to them around them, but also to tap into ways that they can now change their perspective, change the way that they look at the different issues and problems that they're going to face. Those aren't going to go away, but how can we change the way we're thinking about things so that we can now view the world in a different way and find some of those inner strengths that can help us face the challenges of the world. The world is, a challenging place. Our relationships are challenging. How can we find ways to think about relationships in a different way? And that's really the goal of psychotherapy. Let's do a quick review. So what I wanted to do here, I know you're going to be meeting in your discussion groups, but these are the psychological disorders that everybody did their final projects on. So I just want to go over the main points that I want you to know about each of these disorders. You are expected to understand these before the final. Excuse me, so sorry. All right. Important to know, with major depressive disorder, you're going to have a list of different symptoms that someone with depression is going to exhibit. In order to be diagnosed, you have to have at least 5 of those symptoms, and they need to last for at least 2 weeks. All right? Generalized anxiety disorder, it is a relatively continuous state of excessive, uncontrollable, pointless worry. You also might want to take note that to be diagnosed, you need to be in this state and you need to have these different symptoms for at least 6 months for this diagnosis of generalized anxiety disorder. In your textbook, you'll note there are different types of anxieties. There are phobias, there are agoraphobia, fear of being in the out of doors. There's social phobia, fear of being in a social setting. And so there's panic disorder. So you can understand all the different anxieties. For our purposes, we're looking at generalized. OCD, obsessive compulsive disorder. Important to note the difference between the two, obsessions and compulsions. With obsessions, we're talking about the intrusive thoughts. So someone who has obsessions, and usually you will see both, obsessions would be something like, I'm going to die, I'm going to die, I'm going to die. The compulsion is the repetitive behavior that helps the person feel that they somehow have control over those obsessions. So what would be a compulsive repetitive act that I perform to quiet these thoughts of I'm going to die? It might be a cleaning ritual. So if I can get rid of these germs, then I somehow now have control over the fact that I'm not going to die. So obsessions and compulsions, it is an anxiety-based disorder. So one of the treatments would be anti-anxiety medication. But as you'll see in one of the videos you'll watch later, there are some behavioral therapies that can help. Bipolar disorder. So with bipolar disorder, what you mainly see is someone who has major depression, but they also have to have at least one manic episode. And if someone is truly bipolar, they're going to experience both the depression with the mania. And important to note what that means. Sometimes people think bipolar, oh, you're happy, then you're sad. No, manic does not mean happy. Manic is this extreme state of increased energy, impulsive behavior, inflated sense of self, really an out of control, increased sense of energy. So read about that in the textbook to see what that manic episode would look like. Schizophrenia, important to note, it along with other characteristics, you would see two types of symptoms: positive symptoms, which include hallucinations, delusions, and disorganized behaviors. Hallucinations are, there are several types. So we have visual, auditory, olfactory, where you are smelling things, and then tactile, where you're feeling things on your body. And that hallucinations are seeing, hearing, smelling, or feeling something that is not actually there. Delusions are false beliefs. So if somebody believes that the FBI is, has put a wiretap in their home and they're following them, that is a delusion. And then disorganized behaviors, this can be the walking around, talking to yourself. They might be talking to the voices that they're hearing in their head. So those are those disorganized behaviors. By positive, we don't mean good, right? Positive means we're seeing things that are present that in a healthy individual would not be present. So positive meaning present. Negative doesn't mean that it's, bad, although it is bad. Negative means something that should be present in a healthy individual is no longer there. Negative, it's taken away. So we have these three words all beginning with A: alogia, avolition, and anhedonia. So alogia is lack of speech. So normally people would talk, but someone with schizophrenia and they have alogia, they are not speaking. So you would say something to them, they would not speak back. Avolition is lack of motion. So they're not walking around, they're not moving. And then anhedonia is a lack of pleasure or enjoyment. So they have this flat affect where they don't respond. Something's funny, something's joyful, and they don't respond in that normal way. All right. And then finally, post-traumatic stress disorder. This is the only disorder that has an identified cause. And what is that cause? It's a traumatic event. All right, symptoms include re-experiencing. So they have flashbacks, they have nightmares where they see that traumatic event over and over. Avoidance, they will try to avoid anything that could trigger that stress response. So if they are a veteran of war, they might avoid anything, anywhere that they could have like a loud, startling sound, or they're not going to watch movies that show scenes of war. So that would be an avoidance. A physiological response, which is the physical responses, that's that stress response. And then exaggerated startle response, okay? So know those, and you'll get a great presentation from your group members. You may not get all of those, unfortunately. We didn't have everybody complete final projects, so make sure you check out the textbook. Here are the learning outcomes for this video lecture. Following the learning unit, students will be able to define psychotherapy and biomedical therapy. So really, when we're talking about treatment for psychological disorders, we have two types. We have psychotherapy, and then we have biomedical therapy, and you'll learn about both of those today. You'll be able to explain different types of psychotherapies and explain different types of biomedical therapies. If you need to write those down, pause the video, and I'm going to keep going. So here is a definition. Psychotherapy, or talk therapy, is a way to help people with a broad variety of mental illnesses and emotional difficulties. Important to know, there is a wide variety of talk therapies. And when you watch the videos that I've uploaded to the module, you'll see, depending on the approach, the perspective, if you want psychoanalysis, you can go to a therapist who practices psychoanalysis. If you want a behavioral therapist, that's who you can go to. If you want a cognitive therapist, that's who you can go to. If you want a humanistic therapist, somebody who's going to be very genuine and empathetic, you can go to that type of therapist. With biomedical therapies, there are many of those to choose from as well. This involves medication or a medical procedure to treat the psychological disorder. And this approach to treatment really relies on the biological perspective, that what's going on for the individual has to do with the brain and the neurotransmitters that are affecting the individual. All right, so psychotherapy techniques, our textbook looks at these: psychoanalysis, behavior therapy, cognitive behavioral therapy, and humanistic therapy. Again, if you need to write these down, pause the video. If not, I'm going to move on and talk about each of these briefly. So with psychoanalysis, it's based on the work of Sigmund Freud. Psychoanalysis helps to uncover long buried feelings using these types of techniques. Free association. In one of the videos you'll watch on psychoanalysis, you'll see that a typical psychoanalytic therapist would have the client laying down on a couch where they will talk without interruption from the therapist. So they're allowed to just talk off the top of their head, and that's known as free association. So whatever's coming to their mind really allows what's really outside of their conscious awareness to come out. Okay, so they're not purposefully thinking of things they want to tell the therapist, they're just letting it come out. Dream analysis, therapists might assign them to keep a dream journal, bring those dreams in, and then together they will analyze what could that dream content mean. And then transference is a concept. Look at that in the textbook. Basically what transference means is, for the client, they begin to see their therapist as a representation of somebody from their past onto whom they project their emotions. So for example, let's say the client or the patient had a really difficult relationship with their mother, and they have this female therapist, and they start to get angry with the therapist. The therapist says something that the client didn't like, and they start to yell at the therapist. The therapist wouldn't get upset because this psychoanalytic therapist sees that the client is now kind of treating them as their mother. And so the therapist allows this, and they allow themselves to be what they term themselves to be as an object, and allow the client to work through these issues they've had with their mother, and they're transferring those emotions onto the therapist. All right, and that's known as transference. As long as it doesn't get to an unhealthy place, you allow that to happen in the therapy session, okay? Psychoanalysis. Behavior therapy uses principles of learning to change unwanted behavior. So the thinking here is, what's going on for the client or the patient is they have learned these unhealthy behaviors. Depression has been learned, anxiety has been learned, mania has been learned. So how are we going to treat it? We're going to unlearn it. and they use counter conditioning. So remember, back to chapter 6, classical conditioning, operant conditioning has taken place to learn these types of psychological disorders. So counter conditioning is how we're going to unlearn them. In your textbook, you're going to read about aversive conditioning. This is where we're going to use something that is unpleasant to help us not perform that behavior. So for example, maybe I bite my fingernails and I don't want to do that. There are things you can put on your fingers that make it taste bad. There's actually fingernail polish you can buy that tastes terrible. And so when you go to bite your fingernails, it tastes horrible. That's aversive conditioning, all right? So that whatever the behavior is, so I've worked with young adolescents who cut. Right? So cutting is something that people do when they have a lot of trauma. They have a lot of strong emotion that they can't control, so they cut. One technique is to have people who cut either use ice when they feel like cutting, or a rubber band, and they snap that rubber band. It's a type of aversive conditioning instead of cutting. All right, so it's to use that negative behavior instead of hurting themselves. Exposure therapy, this would work well with someone with OCD. So what my compulsion is to touch the doorknob 20 times before I can leave the home. Exposure therapy is a way of using relaxation. So I'm going to use some deep breathing because I'm feeling anxious while I expose myself to the obsession I need to touch the doorknob, but I don't complete the compulsion. I'm not allowed to touch the doorknob 20 times. So I'm exposing myself to this need to complete the compulsion, yet I don't complete it. Exposure therapy is also used in treating PTSD. You'll learn about that in some of your group discussions. How I re-experience the trauma in a safe setting with relaxation techniques. And the more that I talk about my trauma and think about my trauma in a safe, controlled, relaxed setting, the less power that trauma has over me. And then finally, systematic desensitization. This is a way that I take, it works really well for phobias. I take like a fear of spiders, let's say, arachnophobia, and I create what is known as a hierarchy of fear. What are maybe 10 steps that I could take to get me to the point that I could actually hold a spider in my hand? And each of those 10 steps, it could take me a month to move from one step to another. So maybe the first step is just looking at the word spider. And what kind of fear does that bring up for me? And what type of relaxation techniques am I going to use while I'm completing that first step of just looking at the word spider? And then once I can do that and remain calm, I'll move on to the second step, which might be looking at a picture of a spider. And now what kind of anxiety does that bring up for me? And I use my relaxation technique. So systematically, I am desensitizing myself to the phobia. And it works with fear of water, gradually getting to the point that you can actually be in like a pool or a jacuzzi, fear of heights, fear of flying. So this systematically exposing yourself and desensitizing yourself to that phobia until you can complete whatever it is that fear is calmly and using your relaxation. You need the help of a trained therapist in a safe context with those relaxation and coping skills. But behavioral techniques work for certain psychological disorders. Cognitive therapy. So remember, the word cognitive has to do with thinking. So these therapies work on the premise that how you think determines how you feel and how you act. So look at the way these three, this is called the cognitive triangle. Your thoughts, behaviors, and feelings are all interconnected. So if somebody is behaving in or feeling depressed, okay, what this belief is They are having negative, dysfunctional thinking that is triggering this depressed feeling. And then because of that, they are behaving in a depressed way. They're isolating, they're not doing anything, they're laying in bed, they're not eating, they're not sleeping. And so all of this is interconnected. So these self-defeating attitudes maintain the depression. And the way to fix this is to challenge the negative thoughts and find a more positive way to view life. All right, so we have to challenge the thinking that I'm no good, I'm never going to be anything, I'm never going to succeed in life, life is too hard for me. I have to challenge those thoughts and replace them with more positive, functional, realistic thinking. All right, now working off of that evolved cognitive behavioral therapy. So they said just changing the thinking wasn't enough. We also have to change the behavior. So we have cognitive behavioral therapy. It aims to change cognitive distortions and self-defeating behaviors. One of the videos I uploaded on cognitive therapy is really good at explaining the idea of activating events, beliefs, and consequences. So be sure to check that out. And finally, humanistic therapy. How is this different than the other therapies? It helps people achieve their highest potential. Go back to that pyramid of that hierarchy of need, Abraham Maslow's, and at the top is that reaching your own personal potential, that self-actualization. Humanistic therapists focus on the client's present and future rather than their past. They really don't see a need to go back to the past unless the client wants to do that. This is really a client-centered approach to therapy. And three key elements of humanistic therapy, these are qualities seen in a humanistic therapist. Unconditional positive regard for the client, okay? Unconditional positive regard. The client is late, that's okay. This is your time. That's okay if you're late. I'm sure you'll be on time next time. You don't get upset with the client. You don't hold anything against the client. Genuineness in the therapist. You don't try to be something you're not. All right. So if I'm, a middle-aged therapist and I've got a teenage client, I'm not going to all of a sudden try to act like a teenager. That isn't genuine. So if the teenager is talking about something that is, definitely something I don't know about, I would say, you know what? I'm a middle-aged lady. I don't know what you're talking about. Explain that to me. Show me on your phone. Oh, that music. Tell me about your music. Show that to me. I don't know what that is. This is what I did when I was your age. So you want to be genuine. And then finally, empathy for the client. And that empathy is that really trying to put yourself in their shoes. What would life be like for this client? And to really try and feel that so that you can reach out to them and feel what they're feeling so that you can validate what they're feeling and understand what it really is that this client is going through. And it may not seem that that's very powerful, but to have somebody validate and be willing to sit with you week after week after week and take whatever it is that you want to bring into the room, it actually is very powerful and very healing for people. So it is a wonderful approach to therapy. Check out all of those videos so that you get a flavor. They're short, but they show you what these different approaches to therapy actually look like. All right, let's talk about biomedical therapies. Now, this isn't an either or. So oftentimes people are in psychotherapy and receiving medication or a biomedical therapy. So you can do both. What probably isn't recommended is to just do a biomedical therapy and have no psychotherapy. So I'm going to take antidepressants and have no psychotherapy because all you're doing is treating a symptom. You are not resolving the underlying problem of what's going on with that depression. So really important to do both if you're going to use a biomedical therapy. So we are talking about psychotropic medications. And remember from chapter 4 or 5, sorry, I don't have it in front of me. These types of medications, where do they take their effect? At the synapse with neurotransmitters. Then we're looking at these biomedical treatments: ECT, electroconvulsive therapy, transcranial magnetic stimulation, vagus nerve stimulation, and deep brain stimulation. Important to note that these last 4, you need to have a very serious case, very severe case of depression, bipolar disorder, or schizophrenia before any of these would be used. These are not for mild cases or even moderate cases. We're talking about people who have severe suicidality. Maybe they've had suicide attempts, or really contemplating hurting themselves or hurting other people before you're going to do some of these serious biomedical treatments. All right. I hope I have ECT on there. You do not need to know any of the psychotropic medications. Just know that they are a biomedical therapy. Okay, so you don't need to know Zoloft or Xanax or benzodiazepines. You don't need to know those. All right, so this is a picture of transcranial magnetic stimulation. It does have to be performed by a medical doctor or a psychologist trained to do this. But as you can see, it is non-invasive. So this device moves around the head, and the magnets are said to help reset the neurotransmitters by stimulating the different receptors in the brain. I don't know exactly how it works, but I do know it's non-invasive, but they do need to be trained. So there are doctors' offices, psychologists that do offer this. Vagus nerve stimulation it's a surgery. It's a type of a pacemaker that stimulates the vagus nerve. Okay, so there is some theory that a lack of this nerve or something wrong with this nerve is leading to improper amounts of releases of neurotransmitters, therefore depression, anxiety, mania. Okay. Deep brain stimulation, again, it's a surgical procedure where electrodes are implanted into the brain, and then these devices are implanted inside the chest, again, to regulate proper release of neurotransmitters, the receptors, and the reuptake. So I didn't have one of ECT, electroconvulsive therapy. I apologize for that. I do have a link to the biomedical therapies, and you can read about those in more detail in the module. So again, these were the learning outcomes. We defined psychotherapy and biomedical therapy, explain different types of psychotherapies and different types of biomedical therapies. So again, please make sure that you check out the module where the different videos are there so that you can take a look at the ways that these therapies are offered, as well as the website that has an explanation of each of those biomedical therapies. I hope you have a great week and enjoy wrapping up this class, and look forward to the final next week.